Hello, welcome to this live chat. I'm Dr. Amanda Morelli. If you've never joined me before, I host live Q&As to talk all about gut health. So today I'm going to be talking about different types of color of poop and what that means. I get a lot of questions about this. People comment on my videos and ask me, what does it mean if my poop is this color, or I didn't eat any green vegetables, so why is my poop green? So we're going to talk about that, but then I'm also just leaving the chat open for anybody that wants to ask any questions that you might have. I'm here to answer them for you. So let's get started with talking about the different types of poop. I do have a bit of diagram that we're going to go over, so just give me one moment. All right, so here are different types of poop that you might see when you have a look in the toilet. So this one is brown, and brown is what would be considered a normal stool, a normal bowel movement. Brown poop can range from different colors or different shades, I should say, of brown. So if you are noticing brown poop, that is good. That's something you want to look for. And I've talked about this before in other videos or even in my last live stream, but you want your stool to be formed, and you want it to be not too soft and not too hard. So just nicely formed and brown in color. So it could be light brown, it could be dark brown, but that's considered normal. Let's talk about the next color. All right, so the next one is green. So this is green poop. It could be due to a variety of things. A really common cause is something that you ate. So if you ate, let's say, yes, you could have vegetables, but maybe not even vegetables. Maybe you also ate things that had green food coloring in them, or even sometimes blue food coloring. A lot of people have commented on one of my videos that they ate Takis, those like spicy chip things, and then that caused their poop to look in a green color. So that is very common to happen, to have green poop just from something that you ate. Okay, so we have a few people that have joined. So hi everyone, welcome. If you've never been here before, welcome to this gut health Q&A. Feel free to leave any questions that you have in the chat, and I will answer your gut health questions. Right now I'm just going over different types of poop and different colors and what that means. So okay, so we're talking about green. One thing, yes, it could be something you ate. And another thing could be if you're having a bacteria infection. So if your poop is like this kind of green, it could be due to something that you ate that maybe gave you food poisoning. So if you notice like green colored poo, it could be food poisoning. It could be contaminated water that you had and you're having a bacteria infection. So that's something to consider. If it's like green and loose and more of a diarrhea, it could be due to a bacterial infection. The other thing is green could sometimes be normal. If it's like a greenish, brownish color, that can be completely normal. As I said, it could just be due to something you ate. But yeah, one thing to think about is if it is green kind of diarrhea and liquid, you might have eaten something that could have given you an infection. Okay, so some people are saying hi in the chat, so hi everyone. Feel free to leave your comments below. One thing I did want to just mention is if you're new here, make sure to subscribe to the channel and then turn on notifications. You will get notified when I go live, and then that way you're able to just hop on and ask me any questions, because I will be going live weekly, but it could just be at different times as well. So make sure to join, subscribe to the channel, and turn on notifications. Okay, so we have some new viewers here. So just everybody, if you have any gut health questions, feel free to ask me in the chat and I will be happy to answer them. Right now I'm just going over different types of poop. So we talked about brown, which is normal. We talked about green, which can be due to something you ate, but it could also be due to an infection. And then let's talk about black, so black poop. So there are a couple reasons why poop can be black. One of them could be an upper GI bleed. So usually if you have bleeding in the lower intestine, it's going to show red in your stool. That could be from like the lower colon or even the rectum or hemorrhoids. which we'll talk about red a little bit more. But if it's black, it could be from an upper GI bleed, because as it passes along, it just gets darker in color. So that's one thing to consider if you constantly have black poop. But another reason why your poop can look black is from medications and from supplements. So if anybody's ever taken iron, let me know, have you ever taken an iron supplement and then your poop looked black? And that's a very common thing to happen, is you can have black poop from iron supplements. It could also be from different medications. Pepto-Bismol is a common one, so if you ever had to take Pepto-Bismol, it would cause your poop to be black. So that's one thing to consider. So it's really going to be those two things. Either there's some bleeding or something in terms of a supplement, or it can even be something you ate. Again, really anything you eat can change the color of your stool. So if you ever notice your stool looks off, just think about what you ate. Okay, we have some questions. So let's go through these questions that we have, and then I will go back to answering the different types of stool. All right. All right, so there's one question: what happens when I stand up and I get to see what is happening to my body? So I'm not too sure exactly what you're saying. If you could please clarify, are you asking about a specific symptom you're feeling in your gut? So just please clarify that question. Okay, there's another question. I'm feeling nauseous. I'm struggling with constipation and gastroparesis. Any natural remedies for nausea? That's a great question. So nausea, it's such an uncomfortable feeling. If anybody's ever felt nauseous, it doesn't feel good. And if you're constantly nauseous, that can also be an issue too. And it definitely doesn't feel good to be nauseous all the time. You don't want to eat. Constipation and gastroparesis can both contribute to the nausea, because what's happening in both of those cases is you're not fully emptying and digesting well enough. So if there's food left around, it could be making you nauseous. But one of the best natural remedies for nausea is ginger. Now, you could do ginger tea. Ginger tea is a great one. You can even like make yourself a ginger tea and just sip on that before you have a meal to help just calm down any nausea, any upset stomach sensation that you might have before you eat. So that's great. But you can also buy ginger capsules, and that can come either in chewable ginger form, which is great for if you're on the go. Let's say you get motion sickness or you get nauseous when you're out. Having the chewable form is really easy. You don't have to worry about having water, but you can also do capsules as well. So if anybody's struggling with nausea, ginger is one of the go-to things for that. And then there's also chamomile and fennel. Those two would be two other herbs that are really great for helping with nausea as well. So in terms of nausea, that's what I would say. And then with the constipation, having the what's it called, the fennel tea can also help with that as well, and the chamomile tea. So that's what I would say for those. All right, let's see what other questions we have. All right, what if you're constantly going like 5 to 6 times a day? Every time seems like it's urgent. So 5 to 6 times a day is above what we would want an average amount of bowel movements. So as I mentioned, I'll show back the picture. We want it to be a brown color, and we'll go over the other colors in a little bit. But you want it to be brown, and you want to be going at max 3 times a day. Now this does vary depending on everybody, but ideally 1 to 3 times a day is what's considered that normal range. Anything less than that would be more of a constipation. Anything more than that would be considered increased bowel movements, or potentially diarrhea. And if it is loose or liquid or mushy, then that's also an abnormal amount. So, and you also mentioned it's urgent. So urgency is another thing that could be telling us that maybe something you ate is irritating you. So it could have been potentially like a lactose intolerance if you had something with dairy and you urgently had to run to the washroom. If that's ever happened to anybody, leave a comment below. Maybe you had ice cream and then that caused you to have to go to the washroom, or you had like a milkshake or something. But if it is like a loose stool and you're going urgently, it could be something you ate. The other thing could be a bacterial infection. If this is happening like every day consistently, you definitely want to get that checked out. You could have a potential bacterial overgrowth because you shouldn't be going urgently. Urgent is telling us there's something that's signaling your body or your stomach and your intestines that it needs to empty quickly because something's irritating it. So if you have any follow-up questions, let me know about that. All right, let's see what else. Okay. Okay, then the follow-up point was I'm on a keto diet. So potentially there's something in a keto diet, you're having a lot of fat. And fat can be hard to digest. So if you're going like 5 to 6 times a day and you're on a keto diet and you're having a lot of fat, that could be the main reason why you're not digesting your fat properly. Most likely it could be showing up in your poop. Your poop might look greasy or might be floating. Those are signs of fat. And then if it's like mushy as well. So trying if you're on the keto diet, trying like a digestive enzyme to help with digesting the fat could be helpful. See if that changes, but if not, you might need to change up your diet and potentially see if you have an infection, so doing like a stool test. All right, what else? Okay, how long is it not to go without going to the bathroom? Should we be having a bowel movement every day? Okay, then you're just asking about like bowel movements. So as I mentioned, bowel movements, ideally you want to go every day. Now, there are some people that don't go every day, but it could still be considered normal. But ideally you want to have 1 bowel movement a day, up to 3. You want them to be formed, so you don't want it to be diarrhea and you don't want it to be really hard stools as well. So a good form stool and going once a day, that would be considered like the ideal amount for having a bowel movement. And then you should also feel like after you've gone, you should feel complete, like you've fully emptied, because you could be going every day, but you might not be fully emptying, and then that could be considered constipation. So full empty bowel movement, feeling good once a day. All right. Okay, you're welcome. So let's go back to talking about some of these bowel movement colors, and then I'll come back to answering the questions in the chat. Okay, so we talked about brown is normal, green could be due to an infection or something you ate, black could be due to upper GI bleeding or medications or supplements. Now, white. If you ever notice white or pale stool, this is not a good sign. So if your poop is ever white or pale, that's not good. Now, if it's just maybe one time, it could just be a one-off, but if you're constantly having white or pale or gray poop, that could mean you have a blockage in your gallbladder bile duct area. So basically our body releases bile, and that is what gives our stool like color, as well as food and stuff. But if it is white, then that can be there's a blockage. So if you've ever had a bowel movement that's white, or you constantly have it, then that's something you want to definitely look into and call your doctor about that. Okay, all right. There's another question, a little bit about the immune system. So post shingles, and then how do you improve your immune system if you're lactose intolerant and have celiac disease? Oh, that's tough. So you can't have wheat and you can't have dairy. If you're lactose intolerant, you really want to give your body a break from having dairy, even like lactose free, just for a short term, and then after you can go back to having lactose free. So how can you improve your immune system in that sense? So if you're new here and you're not too familiar with gut health, your gut actually hosts a lot of your immune system. It's about like 70 or 80% of your immune system is actually in your gut. So if you have poor gut health, you're gonna have most likely poor immune health. So by working on your gut health, you can improve your immune health and vice versa. So in your case, probiotics can be definitely helpful for that. So usually like just a multi-strain probiotic, which just means a variety of different strains. And then specifically the strain called Saccharomyces boulardii or S. boulardii, that one is really good for supporting the immune system in your gut. So that's something that can be helpful for you in terms of improving your immune system, especially if you have celiac or lactose intolerance, is having a probiotic with S. boulardii. The other thing that can be helpful is just improving vitamin C through your diet. So fruits and vegetables that are high in vitamin C are going to support your microbiome and then also going to support your immune system. Okay, if anybody else has just joined us, welcome. This is our gut health chat, and feel free to ask me any questions in the chat about your gut health and I will answer them. And if you are new here, just make sure to subscribe and turn on the notifications so that way you get notified when I go live again, and then you can join me for questions. All right. What does it mean when your poop is like Maltesers? All right, let me see if I can show you the poop chart. Let's see, the Bristol stool chart. And I will show you what this person is mentioning. Okay. So see type 1, that would be considered like Maltesers. These small pieces, small separated, hard lumps, like nuts, and they're hard to pass. So that is considered a type 1 poop if you're having those like small little pieces. So that means constipation, like pretty severe constipation, and it's definitely pointing towards dehydration. So if you are noticing that those your poop is small and harder pieces, it can also be soft. Soft would be more so type 5, but if it's like those harder small pieces, definitely dehydration. So you want to make sure you're having water, but not only do you want to drink water, but you want to make sure you're absorbing it. So you may need electrolyte powders, or even just something like a coconut water that's high in electrolytes to help you improve your hydration. And then the other thing that it can be pointing towards is that you're not having enough fiber in your diet. So fiber is in things like fruits and vegetables. So some really helpful fruits would be things like kiwis and prunes, or like even prune juice, apples, pears. Those are really good for supporting softer stools. So let me know if you have any follow-up questions to that. But basically it's telling you that it's a harder, more constipated poop. I'll show you the rest of the chart for some reason. Okay, number 2 would be like more sausage shaped, lumpy. Type 3 is, and 4 are better. Those are more normal, more formed. Type 4 is best because it's more softer. 5 is blobs, 6 is fluffy and mushy, and then 7 is a watery, no pieces. So I'll just leave this here for a second. If anybody has any questions about these, just let me know. I'm just gonna go through and see if there's any other questions. Okay. Thank you for the answer. You're very welcome. All right. Okay. So let's see what other questions there are. Is there a difference in the gut with regular versus sparkling water? In terms of hydration, no. Like they're both gonna be water. They're both gonna be hydrating. Honestly, like whatever helps you stay hydrated or get hydrated is gonna be better than nothing. So if you like sparkling water and that helps you stay hydrated, it's going to be able to help you stay hydrated. It doesn't cause any difference. That being said, sparkling water and things with bubbles in them can sometimes cause bloating for some people, just because think about you're getting those gassy air bubbles. So if you are somebody that's prone to bloating, maybe you have IBS or SIBO, which is bacterial overgrowth, you may want to avoid sparkling beverages, because that can cause more bloating. But other than that, I would say it's the same in terms of hydration. But that was a good question. All right, let's see. Okay, if anybody has any other questions, just let me know. Thank you for those likes on the video. I really appreciate that. Okay, I'm gonna go back to the colors of the poop. We're not done yet, so just 1 second. Okay, we talked about white. Remember how I said white is bad? We don't want white. Okay, what about if your poop is yellow? So some of you mentioned, celiac disease. Some of you mentioned lactose intolerant, or on the keto diet. Now, was your poop yellow? Because yellow could be a sign of not digesting your fats properly. So if there is something called fat maldigestion, fat malabsorption, that means you're not digesting and you're not absorbing your fats, and then they're showing up in your poop and they can look a yellowish color. That's really going to be one of the most common causes. So if you ever see yellow or orange in your poop, then that could be a reason why you're not digesting your fats. So typically what you want to do for this is look at your diet. Are you having a lot of fats in your diet? Maybe you need some additional support. So digestive bitters, digestive enzymes, those are some really good things that can help support your digestion. Specifically, a digestive enzyme with bile, because that is where you're going to be able to digest your fat properly, is through the bile. And that's something that you can get in a supplement form. Another reason why your poop might be this kind of yellow, and why it might look yellow or even like an orange color, is maybe you've had a gallbladder issue or you've had your gallbladder removed. And that just kind of goes back to the same thing about the fat, because we need our gallbladder to digest fat. So if you've also had your gallbladder removed or you have gallbladder issues, you might notice yellow in the poop. All right. Let's see if there's any other questions. So just a follow-up from what we were talking about. There was a question about the type 1. All right, so type 1 is what I've had a few times. So just for anybody that's just joined, I will show you the type 1 that I'm talking, or this person's talking about, is this type 1 little poops, hard separated lumps that are hard to pass. I mainly drink coffee all day, every day, and mostly eat meat with some veg. I barely eat fruit. I think I have a bad diet. That's okay. Like, the one thing is you've realized what your diet is like, and maybe now that you're more aware, you can make some changes. So if you're drinking coffee all day, every day, that's something to consider. A lot of caffeine is not good for the body. It's very stimulating. So cutting back on caffeine. And then if you're having meat is harder to digest as opposed to things like fruits. So if you're not eating many fruits, I would consider adding in some fruits. And the main ones that I said are like kiwis, apples, pears. Those ones are really good for helping with constipation. It will help with softening the stool. It will give you some more fiber. So most likely you do need some fiber. And then the coffee is also dehydrating you. So having more water, as we talked about, can be helpful. All right. Let's see what other questions there are. Does diabetes affect digestion? That's a great question. Yes, diabetes can affect your digestion. Diabetes can affect many different systems in the body. And one way it can impact digestion is, let's say you have diabetes and you're on medication, because a lot of people that are on diabetes are on that have diabetes are on medication. So a lot of the diabetes medication can impact your digestion in the way it impacts how well you digest something, and then it can also cause your digestion system to slow down. A lot of side effects, like for example, metformin has the side effect of looser stools, stomach upset. So in that sense, it can impact your digestion. On the other hand, is if your body is not able to properly absorb sugar, like from your food, it could be left in the bloodstream, it could be left in your stomach as well, in your intestines, and it can contribute to looser stool. So let me know if anybody, if you have diabetes or if you've heard of it and it's impacted your digestion when your blood sugar wasn't managed and you had more like looser stools. That's a big issue that it could cause. Yeah, so good question there. All right, let's see what else is going on. I'm going to go back to the poop colors. Okay, so if you just joined us, we talked about brown poop. Brown poop is normal. That's what you want to look for. Green poop can show us that something you ate. For example, you had green vegetables or you had anything with food coloring in it, that would show up in green, but it could also be a bacterial infection. So if you ever had food poisoning and you had loose stool, that can show up there. Black poop is a sign of upper bleeding in your digestive system, also a sign of supplements that you've had, maybe iron or other medications. White poop, remember we said white poop is not good. It could be a blockage, so definitely get that checked out if you've had white poop. And then we talked about yellow. Yellow poop is going to be a sign of fat malabsorption. So that's something there. All right, red. So let's talk about red poop. Now this red poop is like really, really red. Maybe you've had red poop. Maybe you've just noticed a little bit of red. Now red could be blood in the stool. And as I mentioned, blood could be something completely not concerning in a sense of like a hemorrhoid. If you have a hemorrhoid and then you've bled a little bit, that's very common to happen. You might notice blood when you're wiping. You might notice a little bit of blood in your poop. Completely okay. I mean, get your hemorrhoids checked out, but that could be normal. On the other hand, it could be telling us like a sign of inflammation or a sign of colitis or Crohn's disease, which are types of inflammatory bowel diseases. So if you have a lot of blood in your stool, or even a little bit of blood that's always there, or potentially you're having like diarrhea or loose stools with blood, that's definitely something to get checked out. We don't want to have blood in the stool. On the other hand, it could be something you ate. I have a video talking about different colors of poop, and a lot of people agreed that like they had beets and they never realized that it was going to cause their stools to be red, and they thought they were going to have to go to the hospital because they were like bleeding. So if you've ever have a different color poop, just think back to what you ate and potentially it could be due to that. Again, on average, you want to have brown poop. You could have different colors and it could just be a one-off, but if you're consistently having an abnormal color poop, then you want to get that looked into. All right, let's see what else. All right. Do you have any tips for staying hydrated along with having the electrolytes? Do we need 8 cups of water per day? That's a good question. Generally, you want to have like half of your body weight in ounces. So let's say, for example, you were 100 pounds, you'd want to have around like 50 ounces. And I know it seems like a lot, but staying hydrated is pretty important, not just for our digestive system, but for our energy levels, for our overall health. It's pretty important. So in terms of like some tips, some things you can do is even like put a reminder on your phone, and it's just going to remind you at various times of the day to drink water. As I'm talking, I'm getting really thirsty now. You can get yourself like a big water bottle and fill that up and put that, let's say you go to work or you go to school or you're at home, just put it on your desk or put it somewhere that you can see, and just always have the water ready to drink from. One thing that I noticed myself is like I had this water bottle and I just didn't drink from it, and I think it just came down to I didn't like the size of the water bottle. I found that like I had to drink it slow, otherwise it would splash on me because the opening was just too big. Whereas I recently got one that has a straw or a smaller opening, and I just found it was so much easier for me to drink it that way. So you might have to look at that or think about why aren't you having that much water. If you don't like the taste of regular water, We mentioned you can add electrolytes, but you can also even add things like lemon in there as well. You could do herbal teas. That's still going to help with hydration. So a little bit of like chamomile or ginger tea can be a great way to help with your hydration as well. All right, I'm just gonna have a drink of water now that we're talking about that. All right, next question. I'm sorry for this question. Don't worry. It's all good. Everybody just feel free to talk about your poop with no judgment here. I hear it all the time. I talk to patients about it every day, so no worries. I've had poops where they have been really long and wide that's actually cut me while passing. Yeah, that sounds painful. Is it bad? I wouldn't say it's bad if it's just happening, but if it's happening a lot and then they're cutting you while passing, that could be that the poop is too hard. So you may need to look at for more of supporting like a softer poop. We talked about this, like fiber, fruits, water. It shouldn't cut you, because then that can cause irritation, that can cause an internal cut, or which potentially can cause an infection if it's happening a lot. So most likely looking into staying hydrated, making sure you're having fiber. You may need something like a stool softener then if it's really hard as well. All right. Okay, you're also welcome for answering your questions. If anybody just joined us, welcome. This is our gut health chat. I was talking about different colors and different types of poop, and people are just asking questions in the chat. It could be any sort of gut health question, or even if you had another health question, just feel free to ask it. Make sure to subscribe so you get notified when I do these live. So just turn on notifications, that way you can get notified when I go live. Okay, I'm gonna show another type of poop, a picture, not an image. So we talked about all these different colors. This one, I'm not actually sure. I think this is a mix of like yellow and brown, but this one I wanted to talk about here. So this type of poop, you can see these little bits of pieces in them. So has anybody ever looked at their poop and then they saw pieces of food or like undigested particles? Maybe you saw some skin of cucumber or tomato, or maybe you saw parts of nuts or seeds. That is kind of what this picture here is showing, these little bits and pieces. And this type of poop means that there's undigested food in your poop. Now, it could be normal to have undigested food sometimes. Like I mentioned, things like seeds, so like flax seeds and chia seeds, you might notice those in your poop, especially flax seeds. They're just going to pass through you. Something like corn, it's not going to get fully broken down, so like that is normal. But if you're noticing a lot that you have undigested pieces of food in your poop, that can be a sign that you're not digesting things properly, and you need to work on your digestion. So digestion starts all the way in your mouth. You have to make sure that you are fully chewing your food. So sit down, relax, fully chew your food, and that is going to be step number one. Number two is you need your stomach acid to be working well. And then number three is you need your pancreatic digestive enzymes to work well. So if you're not digesting things, if you're very bloated, if you're very gassy, and if you're noticing undigested food in your poop, then you might need to work on your digestion. I think I talk about digestion a lot, but it really is like the key point of improving your gut health is working on digestion. So what you might want to do is have some bitter herbs before you eat your meal to help your body get ready to digest. These kind of herbs are things like ginger, turmeric, gentian, a lot of different types of herbs, fennel, chamomile, all of these types of herbs. You can buy bitters and then have them before you eat to digest your food. So let me know if this has ever happened to anybody, if you notice different stuff in your poop. Somebody said I looked and I thought that maybe I had worms, but they were not worms. What's that? So I mean, it could have been worms, but it could have been, like we said, some sort of food in there. It could have just been like pieces of food fiber. Sometimes not all fiber gets broken down fully and it's going to show up in your poop. So like things like celery and stuff like that, it could have been that and just look like it was a worm. The other thing is mucus can show up in your poop, but that would be more of like a white or a clear kind of slimy substance. That's usually showing there's some sort of immune response. Celiac people, or people with celiac disease, usually get mucus in their poop. People with Crohn's or colitis, when there's inflammation going on, can have mucus in their poop. Yeah, those would be the main causes of mucus. And then it can also just be if you had an infection. So most likely it was either something you ate that wasn't fully digested that was causing it. All right, let's see if there's any other questions. Feel free to ask any questions that you have about gut health in the chat here. Let's see, I think I got all of them so far. All right. Okay. Let's go back to the Bristol stool chart, and then I'll just see if anybody wants to talk about these types of poop. All right, so we talked about type 1. Type 1 are these harder separated pieces. That's going to be really severe constipation there. Type 2, more sausage shaped. So really type 1 and type 2 are going to be your more constipation types of stool. Type 3 and type 4 are more normal. They are more softer. Type 3 has some more ridges in it. Type 4 is going to be really smooth. But remember, with type 3 and type 4 and with a normal poop, it's going to be formed. That's the main thing, is it's going to want to be either 1 or 2 pieces. It doesn't have to be one gigantic piece of poop. It can be 1 or 2 pieces, but generally more formed together. And then you want it to sink in the toilet. You do not want your poop to float. We had talked about yellow poop and like how yellow poop that floats can be a sign of fat malabsorption. Even brown poop that floats can be a sign that you're not fully digesting your fat properly. So type 3, type 4, those are formed and they are one piece there. A type 5 says soft blobs with clear cut edges. So a type 5 is going to be softer than a type 1, but there's still going to be blobby pieces of stool. So now this could be due to lack of fiber, or it could be also just due to something that you ate, or it could be due to more of an infection, like a bacterial infection going on. Type 6 and 7, that's diarrhea. Type 6 is going to be fluffy pieces and mushy, and then type 7 is completely water. So you really don't want type 7. If you're having completely watery stool, usually it means you had a bacterial infection, food poisoning, could even be something like colitis or celiac disease going on. So anything that's not formed is something you definitely want to get checked out, especially if it's happening frequently. So that's the stool chart. Let me know if there's any questions about that. All right, there's a few more questions. I'm scared to get a colonoscopy. Any other recommendations that I can do instead? Honestly, no. Like, a colonoscopy is the only thing that can do what it does. Like, you cannot have an assessment of the colon internally unless you have a colonoscopy. I know it's scary because there's like a lot of prep that goes into it, but if you were recommended this by a doctor or your doctor, then it's most likely needed. What you can do is just make sure you try to calm yourself down before. Try not to read too much into things and like go into chats and things like that, but you always want to just weigh out the pros and the cons of anything that you do. So this might be something to discuss with your doctor. What are the pros of getting this done, and then what are the cons or the risks associated with? And if the pros outweigh the cons, then that's usually a good sign that you should get it done. Unfortunately, there's not really other options. Like, yeah, there's ultrasounds, MRIs, CT scans, but they're not the same as a colonoscopy. So it's a bit of an invasive procedure, but it's definitely something to bring up with your doctor. Let them know that you're a little bit worried about it and see what they say. Okay, one more question here about passing gas. Sometime when I pass gas, it smells really bad, and I mean really bad. Does this happen for a reason, or is it just natural? That's a good question. So one thing I would say is it could be from like vegetables, like or beans, or even dairy. So it could be an intolerance in the sense of maybe you have a lactose intolerance, and you had dairy, willingly or unwillingly, and then you had really stinky gas. That can be a sign of that. It could be completely normal if, you know, somebody has beans or something like broccoli or cauliflower or cabbage. That can make your gas smelly. Now, if you're always having bad smelly gas and it's happening quite often and it's not due to something that you ate, then that can be a sign of a bacterial overgrowth, usually in the small intestine, like so a SIBO bacterial overgrowth, because what's happening is that the bacteria could be fermenting and then causing you to have smelly gas. So I would say assess what you're eating, assess how often it's happening, and then think about is it something you ate, or could it be a bacterial overgrowth? In terms of testing for that, there's the SIBO breath test, there's stool tests that can assess your microbiome. But yeah, that's one thing there. Okay. All right, you are so welcome. Okay, for everybody else that's here right now, let me know if you have any questions. I'm gonna stay on for a few more minutes and answer any questions, and if not, then I will hop off and we will do this again next week. As I mentioned before, I will go live weekly, but make sure you subscribe and turn on notifications so that way you're notified when I go live, because I will be going at different times every week. Okay, I'm gonna go back to some of these diagrams that we talked about. So just back to the types of colors of poop. If anybody missed this, I'm just gonna recap it before we sign off. So brown poop, remember brown poop can range from light brown to dark brown, and that's going to be normal. So if you have brown poop, it's completely normal. Green poop can mean bacterial infection. Green poop could mean you ate something green. Green vegetables, you had things that have green food coloring in it. Even sometimes blue foods can cause this. A lot of people might experience this if they had like food coloring in things like cake or candy. So, okay, hi, we had some people just join us. Hi, green poop, me. So you're having green poop? Yeah, so think about what you ate. Did you eat something that was green? Did you eat something that had green food coloring in it? That could be a reason why. If you have a lot of green vegetables. If not, you might potentially have gotten some food poisoning or contaminated water. Think about like contaminated vegetables. Anything like that can cause you to have a greener poop, because it's basically moving through you faster, and then that's what can cause it to be green. So those are usually the two most common causes of green. The next one was black. So we talked about black and how that could be due to something, a supplement or medication, like iron supplements can definitely cause black poop. It could be an upper GI bleed. So that's one thing to consider. The next one was white. Now remember white poop. Now white poop isn't good. It means basically that there could be a blockage going on. If you have it once and it goes away, it could be normal, but if you're having white poop, you want to make sure you're getting that assessed, because it could be a blockage in the gallbladder, liver, duct area. Yellow poop, we talked about that. Anybody just joining us, if you've had yellow poop, it could mean you're not digesting your fats and they're not getting absorbed, so they're staying in your poop, and then the fat makes it look yellow or orange. And then it could be like a greasy texture or floating, or if you haven't had a gallbladder, you had it removed, I mean, it could be yellow. Okay, somebody also mentioned I had normal poop. Okay, good. I'm glad you had normal poop. That's always a good feeling when you have no issues with your poop. I have red poop too. I don't know. Okay, so that's red. So red poop. So red poop could mean blood in the poop. And we talked about how black is an upper GI bleed. Well, red poop can be a lower GI bleed. And it could be due to something like hemorrhoids, which can be a common thing. If you've had a hemorrhoid that's bursted, it can cause red poop. If you have constipation and you're straining a lot, then that can cause red poop as well. So that's something just to keep in mind. But the other thing is it could be something more serious, cancer or colitis or Crohn's disease, where you're having a lot of inflammation and bleeding. So if you have red poop often, something to look into, but it can also be something that's normal as well. So, all right, so some people are saying hi. So hi everyone in the chat. I'm gonna wrap this up in a few minutes, so just feel free to drop any questions. Thank you for the likes. If you haven't done so already, give this video a thumbs up. It helps get my video noticed across the channel, and I really appreciate it. And thank you for all your questions. Okay, all these poop things you're talking about, is it the same for animals such as dogs? I'm not an expert on dogs or animals, so I can't say that for sure. Some of them might be, but if you have an animal and they're having abnormal poop, best to go ask your vet, because I am not an expert in that. I'm not too sure. Could be, but right now we're just talking about humans because that's what I know best. Okay, so I'm just gonna one time lastly show the last type of poo we talked about. This one was the one that has pieces of food or undigested food. So again, if you have undigested food, if you're noticing like pieces of your food in your stool, it can be a sign that you're not digesting things properly. Now, it can be normal in the sense of things like corn, sometimes even flax seeds or celery or things that don't get fully digested. But if you are noticing that, that's something to keep in mind because you could be having poor digestion. All right, that's everything I wanted to talk about today. As I mentioned, I will do these lives weekly, so subscribe, turn on your notifications so you get notified. The chat is always open for you to ask any questions that you have. I post on, YouTube and Instagram and TikTok and all of those channels as well, so you can keep up with me on those as well. All right. Your dog had poop from time to time, so just wondered if it would be the same symptoms as human. Yeah, I'm not entirely sure. I would say asking the vet. All right. I have tonsils too much. So if you have inflamed tonsils, I'm not really sure what you're asking about. Please clarify that question. Like, did you get tonsillitis or you get tonsil infections? Do you talk about any other things other than the chat today? I mostly just talk about gut health chat. So I can answer other health questions, but it's mostly just going to be gut health. But feel free to ask any other questions about gut health. Undigested food problem. How can I cure it? That's a great question. So if you are noticing undigested food, there's two things that can be really helpful. One, I'd mentioned making sure you're fully chewing your food. Like you cannot just be eating and then swallowing your food very quickly. You're not going to digest it that well. So you need to start in your mouth, chew your food, get your saliva and your enzymes going, and that's going to help you. So that's number one thing. And then number two is if you still need additional support, you can get something like a digestive enzyme or a digestive bitter. And that is going to be helpful for supporting your body to digest the food. So bitters are things like ginger, turmeric, chamomile, gentian is a really good one. You take these bitters before you have a meal, and it's going to help you with digesting your food. If you need even more support, a digestive enzyme with something like lactase and amylase and bile and stomach HCl is the other one, hydrochloric acid. That's going to be helpful for supporting your digestion. So for the person that asked about undigested food, number 1, chew your food. Number 2, try to take something like an enzyme or a better. All right, you're so welcome for answering. Thanks everyone for joining me today. I hope you found it helpful. You can always rewatch this, so it's going to be on my channel, so you can go back and rewatch it if you need to. Okay, there was just another question came in, so I'll quickly answer this. I have an endoscopy this Friday. So an endoscopy or endoscope is where they go into, it's a procedure, you're put asleep, and they go into your mouth and your throat with like a little camera into the esophagus and stomach, and they view everything there. So I'm scared because I've been having chest pain after eating, and the pain at the top of my stomach or roof of my stomach. I was really originally diagnosed with gastritis and a hiatal hernia. Yeah, so I know an endoscopy can be a bit scary. I've had one myself, so I can talk from experience there in the sense of like, if you've never gone under anesthetic before, I can understand that would be a little bit scary. So I always say, like, express your concerns with the person that's doing the procedure, your doctor or the nurse or whoever's there. Just let them know you're a little bit nervous and scared, and that will help them, you know, treat you better, because if they don't know, then they're just gonna like treat you like everybody else. But if you express your concerns, then they'll be able to help you there. But you may want to just make sure, you know, ahead of time, the days before, just relax, do some deep breathing. That's always helpful. Now, if you're having chest pain and pain at the roof of your stomach, it could be gastritis. Maybe they just want to do this scope to check out. It could be something like acid reflux. It could be H. pylori. And then these things are going to be diagnosed with the endoscope. And then hiatal hernia. That definitely can cause what you're experiencing. So they'll be able to assess all of that. So honestly, you'll, you know, just take some deep breaths, discuss it with your practitioner. In the end, like, if you know that it's best for you, then you'll be okay. But all right. All right, everyone. Thank you for joining. As I mentioned before, just subscribe to the channel, give this video a thumbs up, and then make sure you turn on notifications, and we will do this again next week. So if you turn on notifications, you'll be notified when I go live, okay? I'm gonna sign off for now. You're also welcome. Thank you for joining me, and I'll see you next time. Bye.